We'll now begin opening statements, and I want to recognize myself first. Today we take up America's Affordable Health Care Choices Act of 2009. This legislation fulfills our commitment to deliver what the American people voted for last November: access to affordable, quality health insurance coverage for all Americans. The fundamental question before each of us is, will our constituents and our nation be better off in 10 years if we enact this bill, or will they be better off if we do nothing? Today we have the opportunity to make a difference in the lives of all of our constituents. From today, when a constituent comes to us and says, "I can't get health insurance because I have MS or diabetes or any other health condition," we will have an answer. When people lose their jobs and can't afford health insurance, we will have an answer. And when a constituent tells us, "They raised my premium set it so high I cannot afford it because of my health condition," we will have an answer. When a small business tells us the rates for their employees went up when one of them had a catastrophic illness, we'll have an answer. And when our providers tell us they are going under because so many people come in without insurance or have no place to get care except the emergency room, we will have an answer. When people ask, how can the greatest, richest country in the world have 46 million people without health insurance, we will have an answer. When people ask, why don't we prevent illness before it starts and manage chronic diseases so people don't end up in the hospital when it could have been avoided with better care, we will have an answer. When seniors say they can't pay for their drugs when they go into the donut hole in their coverage, we will also have an answer. And we ask ourselves, have we started to make the significant changes in our healthcare system that will change the ever-increasing costs and inefficient way we deliver care? We will have an answer. That we have arrived at this pivotal moment is a tribute to Representative John Dingell, our chairman emeritus, who has made health reform a centerpiece of his long and distinguished legislative career. He has faithfully carried out the work of his father, who first introduced such legislation in 1943, 66 years ago. This effort now qualifies for Medicare. I also want to thank Chairman Frank Pallone and all of the members of the committee who have made contributions to the Dingell bill, and I'm honored to be a co-sponsor. H.R. 3200 is reform in its truest sense: expansion of access to health care, improvements in the quality of health care services, better public health outcomes, and control of costs for the benefit of all Americans. Today, America's health care system is no longer affordable. At $2.5 trillion per year, 16% of our gross domestic product, it costs too much for individuals, businesses, and the economy generally, and it delivers too little quality care. Our legislation delivers fundamental change. Health insurers will have to compete based on cost and quality, not on who is most effective at avoiding the risk. Our bill will unleash a series of delivery system reforms to reduce health care costs. If we do not enact this legislation, there will be no significant cost control reform, and health care costs will continue to rise. Our legislation will provide insurance coverage to 97% of Americans. If we do nothing, the number of uninsured will rise to 54 million. And our bill will dramatically increase access to preventive services. Under our legislation, Americans will always have access to affordable coverage wherever they go. Families can pick the insurance plan they want and their own doctors, and this legislation is fiscally responsible. We will assure that it will be deficit neutral and is fully paid for. Today is an historic moment for our committee, and I'm certain we will be worthy of the opportunity we have to make a decisive difference for the better in the lives and the health of the American people.